an in vogue topic, ketamine therapy, which has a long history of use as an analgesic, but in a more recent fashion is being explored for PTSD, depression, anxiety, and even for substance abuse. The way ketamine is being administered is becoming more and more accessible, meaning traditionally it's often been given as an IV. However, it's now being administered as a nasal spray. And even in some cases or in some telehealth settings, as a nasal spray you can use at home. I'll come back to options in a moment, but let me lead with what this study found. Now, firstly, it was a meta-analysis looking at people with depression and suicidal ideations. People were given either medication plus placebo or ketamine plus medication. What they found was that the addition of ketamine led to improvements in depression within 24 hours of administration that lasted for up to 3 months. And to quote here, patients with major depression and suicidal ideation benefit from the use of ketamine. What I find to be so exciting here is that this was not administered, the ketamine, it was not administered with psychotherapy. And oftentimes you'll hear this recommendation that if you're going to use a compound such as this, it must be used along with psychotherapy. And I have no reservation about that. However, it's one more barrier of entry to utilizing a therapy that may take this off the table for some people, right? I always picture someone who's struggling with their health. They have limited time and limited resources, right? As a clinician, this is where my mind goes. So how can we get someone to therapies that are safe and will help them without putting too many barriers in their way? And this, I believe, is one of the first studies of its kind showing that the ketamine, again, did not have to be paired with multiple sessions of psychotherapy in order to have its benefit. Again, I have zero quarrel with the combination, and I think it's probably better to have that combination than to just use the ketamine nasal spray by itself. Again, however, if someone's limited with their time and with their resources, I really appreciate what this study found in its ability to improve depression. And it also makes sense to me when we understand some of how these compounds work in the brain to actually change or lead to plasticity, allowing the brain to fire different pathways than the depressive thinking pathways that might be facilitated. Now, coming back to ways that you can access this therapy somewhat easily, here are a few options for you that do telehealth prescribing. New Life, Better You, and also Joyous. Alternatively, you could look into a local clinic that offers ketamine, usually administered as an IV and usually done in conjunction with psychotherapy. But again, to give you all the options, if you are someone struggling, ketamine has a few different ways in which you can on-ramp and access it. Of course, always check these things with your healthcare providers, and I would discourage anyone from using black market ketamine because it's so easy to obtain a prescription now, and you should really be doing so underneath the guidance of a prescribing. So anyway, exciting study, one of a growing number on ketamine and how that can help with mood if you are struggling with depression and or suicidal ideations.